syndrome of inappropriate ADH release. So in this condition, there is this euvolemic hyponatremia. You see the patient coming with you with the weakness, okay, confusion, even sometimes if because of the hyponatremia there is a severe confusion, delirium, coma. These are the conditions. So how will this is how the patient present to you with severe weakness, can't able to like there's a lot of symptoms of hyponatremia, but the most commonly is weakness, severe weakness. Now, causes of hyponatremia, causes of this SIADH. There's a long list of causes, but the most the, the thing which we have to learn is neoplasms, respiratory conditions, neurological conditions. So neoplasms are your lung cancers, your duodenal cancers, kidney cancers. Along with that, there are conditions of brain like Guillain-Barré syndrome, multiple sclerosis. The respiratory condition, most commonly asthma. Asthma is the condition in which asthmatic patient will present to you with hyponatremia. You most commonly see it is due to SIADH in them. There are conditions of respiratory conditions like your positive pressure respiration, right? So these are the conditions which causes your SIADH. Now, how will we treat? So there are acute presentation and chronic presentation. So if patient is presented to you repeatedly with the same symptom like symptoms of hyponatremia, you categorize them in the chronic SIADH. Now the acute presentation will be treated with 3% hypertonic solution, 3% hypertonic saline. But the thing is to remember here is you have to give it very slowly, 30 ml per hour at the rate of 30 ml per hour. The hypertonic solution NaCl 3% at the rate of 30 ml per hour, 20 ml per hour. Okay, don't give it too fast. The complication of giving is deadly. Is deadly, and it is called as cerebropontine myelinolysis. Cerebropontine myelinolysis. This is the condition in which the neuron cell death will occur due to the hypertonic solution. Because what happens in chronic SIADH patient is that their neuron cells are adapted to this hypotonicity in the blood. Okay, euvolemic hyponatremia. So they are adapted to hyponatremic conditions. They are adapted to low sodium levels. When you give excess sodium levels, hypertonic saline, ultimately what happens is the water inside the neuron cell will come out into the blood and the cell death will occur. So this condition has to be prevented by giving it very slowly at the rate of 20 ml per hour. Now chronic SIADH patients are also treated with the drugs including Vaptan class of drug, democlocycline, fludrocortisone. These are the drugs. Now one of the most important drugs is Vaptans. These are the V2 receptor antagonist of ADH. Because of the excess ADH, if there is no action of ADH on the receptors of its own, there will be SIADH. So we'll use the drug called conivaptan, tolvaptan. All these drugs act on the V2 receptors of collecting duct of the nephron. Now other treatment, as I said, fludrocortisone and democlocycline. These are the drugs. There is this one criteria for diagnosing this condition which is called as Barter-Schwartz criteria. It includes your low serum osmolality, urine sodium level more than 20 milliequivalent per liter. These are some of the points which includes Barter-Schwartz criteria. And that's all about the SIADH.